I'm Whitney Dean. You've been listening to Talk to the Experts on News Talk 770. And, if you wear glasses, maybe you should be wearing glasses, but you just hate wearing them. There's a lot of hassle with them. A lot of people look into how to permanently treat it so that they never have to worry about it again. You can see night or day, there's no problems. But also, there's a lot of questions about surgery on your eyes. How safe is that? Maybe they have some fears about surgery, or they wonder if their eye conditions, if they even qualify. So Dr. Ahmed Al-Ghoul is the founder and director of Clarity Laser Vision. That's Clarity Laser Vision. He is here today. He's able to answer those questions. You can find them claritylaservision.com. That's claritylaservision.com. And he's here this afternoon. Good afternoon, Dr. Al-Ghoul.
Good afternoon, Whitney. Thanks for having us here.
Okay, so first things first, I really want to know, corrective surgeries for eyes. What are who qualifies for these now?
Well, that's a great question. And I think when it comes to corrective surgery, the first thing that we want to make sure of is that the patient's refractive error is stable. Mm-hmm. So if somebody's coming in and their eyes are still changing, because we're trying to find a permanent solution, can be a bit of a challenge trying to correct that until they actually completely stabilize. An age minimum requirement of 21 is ideal. Mm-hmm. 18 is a minimum, is sometimes considered okay, but it's an exceptional circumstance to do it at 18 years of age in my practice. Mm-hmm. And the reason we kind of wanting to do patients that are 21 and older is because usually their eyes are more stable and not changing as much by that point. Mm-hmm. It is a procedure, of course, and like any procedures, you want to make sure that the person is healthy enough to have it done. And so we have to go through a rigorous process to make sure that not only do their eyes qualify, but also their entire body is healthy enough to undergo surgery. There's no systemic reasons, like diseases of any sort, that could prevent them from having surgery. And you want to make sure that we have the right expectations set in terms of what corrective surgery as of 2017 can achieve. Mm-hmm. So that's another important thing that we want to make sure that we communicate clearly with our patients.
Yeah, I want to get to that in a little bit later. So what options are there, first of all, for people when they're starting to look at corrective surgeries? Because I think for many, they hear LASIK and they don't really know anything beyond that.
Yeah, that's a great question. I mean, I think I just want to kind of point out that 2017 marks the 30-year anniversary of the excimer laser technology that has been used on people's eyes now.
Really?
Yeah, so it's been around for 30 years. So we have a lot of experience having done so many procedures for the last 30 years as a profession, mm-hmm. in being able to give our patients the best and latest options. And so going back to your question, the most common procedure that's still being done in the world today is LASIK, which mm-hmm. A lot of people have heard of that. PRK, which is actually predates LASIK, is still around, and there's been various iterations of that, which we will mention later in our talk and update the audience about. But there's also other exciting intraocular technologies that have been around for a fairly long time, and they're making more headways now in the world of refractive surgery pertaining to patients who have more than the normal range of refractive errors, or those who may have not traditionally been qualified to have LASIK or PRK. And as we age, of course, our eyes change, and sometimes there are certain procedures that we would do for 50-plus individuals that are now becoming more common, such as refractive lens exchange, which that is analogous to the same sort of thing you do with cataract surgery, where you're replacing the natural lens of the eye with an artificial lens. So mm-hmm. you basically are left with about four options, and trying to navigate now all those options really requires someone who can really understand the pros and cons of every technique as it pertains to the individual coming in, and understanding, where in their life they're at, and whether, could they be a better candidate for, say, something like PRK or TSA, like we're talking about, or LASIK or RLE or ICL. I mean, that's why I think it's more about truly finding a customized solution for every person that comes in.
Yeah. Okay, you've thrown out a lot of acronyms. One of the ones I wanted to get to is the TSA, or it's Touchless Surface Ablation. I don't even know if I'm saying that one right, but TSA, we're going to go with that. So what is that one? Because this seems like the newest thing that's available for people.
Yeah, you actually got it right. So that's really good. I mean, TSA essentially is a new approach to doing PRK. So when you look at what we're doing for a patient who comes in with a refractive error, we're using the excimer laser system to essentially remove excess tissue from the cornea. And because it's such a precise laser system, we're doing it in microns. So, for example, I would say about 15 to 20 microns of tissue removed equals about a diopter of refractive error.
Okay.
So if someone comes in like -2, it is about 30 microns, give or take, of tissue that you need to remove. So, but the thing is that the cornea, the whole structure of the cornea is about 0.5 millimeter thick. And as a corneal specialist who deals with cornea for various things, I could tell you that the thing that's important when we're talking about trying to achieve that sort of goal of permanent vision is you want to be able to treat the structure that really doesn't regenerate as often, which is the stromal tissue. And I know that's another lingo term, but what I'm trying to say is the stromal tissue is this tissue in the middle of the cornea that's the tissue that does not regenerate. So if you can sculpt that structure right, then you can improve someone's vision.
And it will stay that way because it's not regenerating. So then it doesn't mean you're going in for surgery all the time. You're reshaping it, and then it's most likely permanent.
Well, that is always the goal that we achieve, that we want to achieve. But I think that what I would say is that over the last 30 years, we've gotten through various iterations of the excimer laser system. So the system that we have now is a six-dimensional laser, sixth-generation laser system that tries to ensure that we get the best possible outcomes from a point of view of maintaining that outcome the way it should be. And our successes are fairly high now in terms of the percentage of patients who actually maintain that vision for the long haul after one procedure is a lot higher than, say, a laser system that's 5 or 10 years older. So in regards to I was saying earlier, the TSA, we have a top layer called epithelium. That's the layer that you need to protect your eyes, sort of like your skin. You need a strong barrier on your skin to protect from things like infections, heat, and other things. So that layer on the cornea, it's constantly regenerating. So we have to essentially remove it out of the way and do the correction or the sculpting, if you will, to the tissue deeper than the epithelium so that you can achieve that desired permanent outcome. And so with PRK, the older techniques required the surgeon to essentially manually remove that layer, which is never a very appealing thought, if you will, right?
I'm just thinking about that now. It's like, so you're cutting into the eye.
Right.
Okay.
You're either using a brush, like a medical brush, or using chemicals to essentially peel that epithelium out of the way.
Which why a lot of people got a bit scared when they think about it.
Right, and I think that's what makes LASIK also a bit more appealing because it doesn't have that potential discomfort that you would expect with something like PRK. But what TSA essentially did is it automated the entire procedure. I mean, what we do with TSA is I essentially put an eyelid holder in someone's eye and I press on the foot pedal.
Wow.
Right? I mean, I don't actually touch the eye anymore. And the reason we do that is because there's the latest lasers are having so much precision in their ability to track the eye. So, for example, with our laser platform, we have a six-dimensional tracking capability. So, essentially, the laser now can track your eye in almost all directions. And so it can remove the epithelium all at the same time while it's trying to remove the stromal tissue that's sitting beneath it. So the whole thing, on average, takes about 20 to 30 seconds to do per eye.
Okay, so it's a heck of a lot faster than what it used to be then.
Absolutely. The speed of the lasers now are a lot faster. I mean, we correct about a diopter of refractive error in about 1.5 seconds.
Wow.
Yeah.
Okay, so then what about the recovery time afterwards, after a surgery like that?
Well, the beauty with TSA, and I think we have to sort of think about what we're talking about, which is really an advanced version of PRK. So you get the PRK technique, which is, like I said earlier, epithelium has to get out of the way. Then you do the treatment deeper in the eye. But then you need the eye to heal itself, which can take a week to two. What we're dealing with, when we're dealing with TSA, it's faster because the laser only removes only epithelium that it needs to remove. Typically, when surgeons are having to remove the epithelium manually, we can't tell exactly what part of the epithelium we have to remove. And so in other words, we try to be a bit more generous in the amount of epithelium removed to allow for that laser to do the sculpting on a deeper structure. So like if you have like a table with a tablecloth and you want to do something on a table, well, and let's just say you can't really pinpoint exactly where you want to do it on the table, so you take out the whole tablecloth.
Yeah.
Whereas the laser says, no, I'm just going to remove the small section within the tablecloth and then do whatever I'm doing beneath it and cover it up again. Mm-hmm. So it allows for a faster recovery because of that. And I think the reason it's exciting for me in terms of the TSA is just because of the fact that it is truly faster than, say, doing LASIK. And it is also not as uncomfortable as, say, doing traditional PRK, because sometimes using the various traditional techniques of removing epithelium can be a bit more uncomfortable.
Mm-hmm. Yeah. Learning from Dr. Al-Ghoul, who's from Clarity Laser Vision, about some of the permanent ways that you can correct your vision. You can find them claritylaservision.com. That's claritylaservision.com. You can also call him 587-317-1809. That's 587-317-1809. So coming up, I want to talk about how he customizes it, how he goes through options, and then what an appointment and surgery and recovery time and follow-up look like as well. So a lot to get to. And there's also a few other services that I want to talk about as well after we just learned about touchless surface ablation. I'm Whitney Dean. You're listening to Talk to the Experts with Clarity Laser Vision. I'll be back in a moment.